Good afternoon. I'm Dr. Ken Lippincott, and I'd like to uh, call the Executive Committee of the Mississippi State Board of Medical Licensure to order. Um, I'm joined by Dr. Kirk Kennard, and we serve as the quorum for the Executive Committee at this time. We have five items on the we have 7 items on the agenda, and the first item is an investigation into an application for a permanent medical license. And this will need to be held in executive session pursuant to Mississippi Code 25417. And we have the Pam, what's your last name? Pam Ratliff. She's with us from the AG's office, and Paul Barnes, our attorney. What do you need to tell us, Paul?
I was going to ask that the committee consider a motion to go into closed session to proceed executive session so that we can discuss an application for licensure, and that is confidential pursuant to statute.
I'll make a motion to close the meeting or to go into an executive session. Further discussion.
Okay, can I second that?
Technically, you do not have to second it. You can,
Okay.
but in discussion,
Any discussion prior to closing the meeting? The meeting is closed.
okay.
And to go, oh yeah, we're closed. All right. open session. And Dr. Kennard is going to report the action of the EC.
Yes, executive committee met regarding the matter. Thank you.
Yeah, and we did provide some guidance to the executive director regarding this matter. Item number 2 is a Zoom appearance by Barbara Levy, MD. Dr. Levy, are you present?
Yes, sir. I'm here.
Thank you. Could you tell us the reason for your appearance before the executive committee, Dr. Levy?
So we are looking for an exemption for the 75-mile rule. Vizana Health is a 50-state virtual women's health company. I am physically located in San Diego, California. I'm the chief medical officer. I supervise about 25 nurse practitioners, one of whom has a license in the state of Mississippi, and we're seeing between 5 and 10 Mississippi patients per month. And the goal of Vizana Health is to reach women specifically who are having access to care issues, who are not able to interact with bricks and mortar physicians for whatever reason. And so we're really trying to fill a gap, not to displace existing relationships, but to be available to women who have needs.
Thank you, Dr. Levy. Could you tell us a little bit more about the nature of your practice?
Sure. We are doing gynecology only, so we are not practicing obstetrics. And we are seeing women from adolescence through menopause, managing hormonal issues, polycystic ovary syndrome, heavy menstrual bleeding, chronic pelvic pain, many, many things. We are a clinic. We can write prescriptions. We can order ultrasounds or laboratory work. And again, the whole goal is to reach people who've been either disenfranchised from the healthcare system or unable to access. So we're open 14 hours a day across the country. We find women accessing us from their cars at their lunch break, different ways that we're able to reach people who just have not been able to get care.
Okay. And how long have you been licensed in Mississippi, Dr. Levy?
Sometime within this year.
And have you practiced here before?
I have not. No, my private practice was in the state of Washington. I practiced for over 30 years there and then joined. I'm sorry, go ahead.
How many states are you licensed in?
All 50.
Okay. And you have one NP licensed in Mississippi.
Yes.
And she's not in attendance today, is she?
She is not.
Okay. Could you tell me what do you know about her qualifications?
Yeah, she's been a nurse practitioner for over 30 years. She practiced in a brick and mortar practice for a long, long time. She is very highly experienced. So we don't hire anyone to do telemedicine in women's health who has less than 5 years of experience. She has more than 25 years of experience. And I'm really hands-on in terms of overseeing the care that's being delivered. So I look at every new patient chart every day and use that as an opportunity to guide and teach. I'm also available to the nurse practitioners by text all day, every day, when they have a complex issue or something that needs to be escalated.
And this is your NP in Mississippi. This is Miss Newsom, Elizabeth Newsom?
Yeah, Elizabeth Newsom.
And she's located in Minneapolis?
No, she's located in North Carolina.
North Carolina.
Yeah, the company address is in Minneapolis. She's located in North Carolina.
Okay. Um, Dr. Kennard, you got any further questions or discussion?
Yeah, sure. Go ahead, please.
Hey, Dr. Levy, my name's Ken Cleveland. I'm the executive director here at the medical board. During executive committee, sometimes I tune in and help ask some questions to further elucidate exactly the nature of the relationship. So if, and I'm sorry, the nurse practitioner's name is not in front of me.
Libby Newsom.
All right. If Ms. Newsom has an issue at 8 o'clock in the morning, North Carolina time, which would be 5 a.m. California time, are you available to advise her?
Yes, sir. I am.
Okay. And do y'all share a medical record system where y'all can both see the same charts at the same time?
Yes, we use Athena.
Okay. And you made the statement that you're licensed in all 50 states. Are you familiar with the state of Mississippi collaboration rules as far as how many chart checks a month you're supposed to do?
Yes.
Okay. That's all I have.
Dr. Lippincott. May I?
Yeah.
And I'm Paul Barnes. I'm the board attorney. I just wanted to follow up on a couple of things Dr. Cleveland mentioned. I noticed that in your submission that it calls for monthly chart audits of 10% or 20 charts, whichever is less, which does comply with the Mississippi rules. I noticed that under telemedicine authorization, it states that the APRN is authorized to provide telemedicine services in compliance with state regulations. And so my question is, do you understand what Mississippi regulations require for telemedicine as far as audio-visual interaction? And the point I'm trying to get to is that asynchronous only is not permissible under current Mississippi regulations.
Understood.
So how does your protocol exactly work for telemedicine?
So we see patients using audiovisual technology through Athena. There is asynchronous communication occasionally with the patient through a platform, but it is not patient care. So the asynchronous communication might be, were you able to pick up your prescription? Or do you have any questions for us? But the care is delivered synchronously by audiovisual.
Thank you. That's all I have.
Yeah, I had one question too, Dr. Levy. Thank you for your time and clarification. In the event of an emergency situation, whatever that might be for your specialty, we don't even have to get super specific, but I can imagine in something you mentioned in a bleeding situation, it becomes acute. Do you have conduits, relationships, otherwise transfer agreements to take care of more acute situations for the patient, since neither of you is in the state?
We do not have transfer agreements that are official. What we do is anything that is urgent is escalated to me right away. We have a team of care coordinators, navigators who will find the closest emergency room for the patient. We will phone and talk to the emergency room physician or practitioner and let them know what the situation is and be prepared for the patient.
Okay. And lastly, I think it's pretty standard in these protocols, even in my own, in my personal practice, to include some clarification about how you manage controlled substance prescribing. So obviously that's a hot button
Quite
issue.
simple. We don't prescribe them.
Okay, well, I wanted to clarify that because I know it's mentioned a lot, but if it's not part of in any of the 50 of your states under this practice that this nurse practitioner will be, these protocols, no controlled substances are prescribed?
Correct.
Okay. Thank you.
And just another question, who would, is there a backup physician in case you're not
Yes.
well, and who would that be?
So there are three, actually. There is Dr. Chardonnay Vance, who's a primary care physician who's full-time with us. Dr. Sean Cole is the practice owner. He's also primary care. And then Dr. Siobhan Rary is a board-certified endocrinologist and obesity specialist, and she's full-time with Vazana as well. So
And-
she is the first backup. Her time zone is actually Central Time, so it's a nice complement. And then the other two are available if for some reason the two of us are not available.
And they're all licensed in Mississippi.
No, Dr. Cole is, Dr. Rary is not. And Dr. Vance is. So I think Dr. Rary is the only one who is not.
Any further questions or discussion? If not, we can entertain a motion.
I'll make a motion to accept to approve the exception to the 2080 work rule in this case.
I'll abstain. Can I make a motion to close the meeting to consider whether to go into executive session
Discuss the application.
to discuss the application? Yeah.
Okay.
Okay.
Okay, motion is.
I will sign off. Thank you very much for your consideration, and we're happy to answer any other questions that you might have.
Please stay on the,
Oh, okay.
for us. Yeah, the board members would like to go into executive session to discuss whether to approve this or not, and then we will come back and get you an answer, okay?
Thank you. Appreciate it.
Thank you. The committee is now back in open session, and I will ask Dr. Kennard to report on the executive committee's action.
Yes, the executive, is everybody back on, Dr. Levy? That screen looks different than it did before. There we go. Okay, Dr. Levy, you can hear us?
Yes, I can.
All right, thank you for your time today. The executive committee met and voted to deny the request on both counts, the 70-80, 75-mile rule exception and the 2080 work hour exception. Any further clarification about that decision can be directed to our executive director, Ken Cleveland, next week.
Okay, thank you.
Okay, thank you.
Okay, it is, we would like to acknowledge that Dr. Michelle Owens, our board president and president of the EC, is in attendance. And I would like to ask her if she would like to take over the chairmanship of the meeting.
Hi, Ken. Yeah, I'm here and I'm on. Hi, everyone. And so I'm happy to do that if you want me to. We can move on with the next is going to be the Zoom appearance by, it looks like Ramey Khoury from Covington, Louisiana.
Yes.
And this is a request for an exemption for the rule, for the 2080 rule, and the 75-mile rule, as well. And so, Dr. Khoury, who else is with you? Do you have anybody else, or is it just you?
I'm by myself.
Okay, fantastic. Well, why don't you go ahead and at this time you can address the executive committee about your request. Tell us what you would like to do and what you would like for us to do.
Good afternoon for the executive committee, and I appreciate everyone's time for meeting with me. My name is Dr. Khoury. I'm a neurologist who had the opportunity to meet with the executive committee for a similar request probably a couple of years ago, if my memory is correct. So just to remind you, I'm a neurologist based off Covington, Louisiana, and we have a practice called NeuroCare of Louisiana, doing business as NeuroCare of the South, and we started a clinic in Macomb, and which have been busy taking care of patients, and we're very proud to have the clinic there. I have a nurse practitioner. Her name is Destiny Broom. She's a exceptional nurse practitioner who's based out of Summerall, Mississippi. And we were looking at discussions, and one of the suggestions is that there's a huge need in Hattiesburg, Mississippi, for neurological care. And I looked at the numbers. The population is about 170,000. There's about the ratio is about 2 neurologists per 100,000, which is very, very low. And it's actually one of the most underserved areas in Mississippi for the care of for neurological care, including dementia, stroke, seizures, etc. And I have another nurse practitioner as well who lives in Poplarville, who's as well close to the area, who's interesting as well in helping out in Hattiesburg. And just I'm very present, or I am present. I'm very present in Mississippi from care perspective. I usually go there every couple of weeks. I do dementia evaluation on the patient. I'm always in touch with nurse practitioner on a daily basis. And really the intention is to build slowly and see how the need is for Hattiesburg for neurological perspective. We have a location already in mind. We're gonna a use space with from a cardiology nurse practitioner. We just by talking about it, we already have a good amount of referrals. I think the need is going to be there. I'm planning as well, probably to go an average physically there myself once a month, and then depending how the needs become, we're going to start slow and hopefully be able, with your approval, to serve the community there.
Thank you for that.
Absolutely.
So I will at this time open up the floor to the members of the executive committee to see if you have any questions for Dr. El-Khoury.
Dr. Khoury, I'm Ken Lippincott, Vice President. And you mentioned that you had applied for an exception before. Could you tell us about that?
Yeah, absolutely. So it was exactly the same concept. Covington is actually about 75 miles from Macomb, so it's really at cutoff, 75, 76. We have a clinic. We have a very structured infrastructure. We have staff there. We have MAs. We have nurse practitioners that are very well trained. We offer tele as well. I think we're literally across the road from SMRMC, the hospital. I really proud of our team and our work there. I think there's a huge need. I honestly think there's a huge need in Macomb, and I think Hattiesburg is going to be very similar, if not busier, to tell you honestly.
Okay, thank you. I guess I'm a little confused. If you already have an exception, why do you need another exception?
I emailed the board and I told them I'm operating in Mississippi. I don't know if it's site specific or something. It's actually the same team that's going to be working. It's not.
It's a second clinic with a different nurse practitioner.
It's additional site. Okay, I understand. Thank you.
It's the same. It's the same MPs. It's the same MPs I'm already using. But I didn't hear. But whoever mentioned is correct. It's an additional site.
Okay, thank you very much.
Absolutely.
And if I could, Dr. Owens, this is Paul Barnes. I handed Dr. Lippincott a copy of the minutes from July of 2022, and that's when the original exception for the Macomb location was granted by the executive committee.
Thank you for sharing it.
So, Dr. El-Khoury, tell me this: how exactly? So, so you're currently practicing. Where is your physical location?
So
right?
my main location is Covington, Louisiana.
It's Covington. Okay, that's what I thought. So help me to understand. Now, I know that neurologists are in short supply in general, because Covington is probably not super saturated with neurologists as well. But there's also, so how exactly, what's your current schedule like with respect to, because I don't know a neurologist that's not super busy. Every single neurologist I know is super busy. So tell me how this, what's your breakdown right now with just respect to the time that you have available, and what your work situation is like to be able to provide care and
so
in this particular additional clinic. You have two busy practices all day.
So to answer your question is, as you said, all neurologists are very busy, and I am very busy, but I actually have a very good infrastructure. I've been running a neurological practice for a good amount since 2016 actually, and I think I have a very good staff. I have a backup neurologist, Dr. Azar, and we just hired another neurologist, Dr. Gloss, who's applying for his Mississippi medical license, who's going to have time in Macomb. So really, I'm shifting manpower from Macomb. I'm I'm shifting some of the manpower of Macomb to Hattiesburg if the committee allows to be able to cover the state of Mississippi better.
Okay, because I mean, I wasn't trying to get too much into your business or your business model per se, but it is interesting just recognizing the demand that exists and how few neurologists we really have, like how we are creating a situation that will provide good balance. But thank you for that. Additionally, no, it's hard. When we're on Zoom, it's hard to kind of not know when the pause is so that you can speak. But the other question that I had as it pertained to the practices, so neurology, at least from the time I was a medical student, has changed a lot, even if the neurologic pathology processes haven't really. There have been a lot of innovations and things that are being applied in neurology. And so with respect to like procedures and those kinds of things, like what's the real nature of your practice? A lot of the stuff that we have in front of us refers to like sleep medicine and those kinds of things. But is that kind of, what do you envision for this new practice? Is it going to be a general neurology practice? Is it going to be a practice that has a focus on sleep medicine where the majority of stuff's going to be like obstructive sleep apnea and those kinds of things? Like what exactly do you envision and how are you going to be utilizing the nurse practitioners with whom you collaborate in the care of these patients?
Doc, very good question. And I'm sorry before, I didn't mean to interrupt you.
No.
So to answer your question is from a procedure perspective, the three main procedures that we do is EMGs, and actually there's myself and there's another neurologist, Dr. Ramey, who does EMGs in Macomb. And then the other procedures that we do, and we have a very strong infrastructure, is EEGs for epilepsy. Really the area of interest that is growing, and I'm sure a lot of you have heard about, is dementia care. And there's too many one, I'm really trying to push for awareness of early diagnosis of Alzheimer's disease through education. And from an MP perspective, we meet on a weekly basis to discuss cases, we have a weekly meeting. But from patient care perspective, we're really trying to have a little bit more impact as well on dementia care. So I do dementia screening, and we just started infusion for mild cognitive impairment and dementia for our patients. And we have some Macomb patient that we started doing infusion and touch and wood, and luckily they are doing very well, and we do follow-up imaging. So we have we are general neurology, but we're trying to build specific areas. Dementia, epilepsy, stroke care is probably our biggest focus, and concussion as well, post-concussion care.
Awesome, thank you. Any other questions from members of the executive committee? If there are no further questions, then we can entertain a motion.
I make a motion that we approve the exception to the 75-mile rule and the 20-hour rule.
I second that.
All right, it's been moved and properly seconded that the request for the waivers for the 20-hour rule and the 75-mile rule be approved. Any further discussion on this matter? Hearing none, all those in favor say aye.
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 Well, that's pretty much everybody. Okay, great. And there's mine. So then that means that the request has been approved. So thank you, Dr. Khoury.
Thank you, everybody, for your time. And
Thank you.
thank you for approving and your trust.
Thank you so much for the work that you're doing for the people of Mississippi.
Absolutely, my honor.
All right, so now we can move on to the next item on our agenda, which should be item number 4, which is a Zoom appearance by Samantha Roth, who's a physician's assistant, and Grant Bullock, DO, from Las Vegas, Nevada. And there they are.
Can you hear me?
Oh, hi.
Hey, how's it going?
It's great.
Awesome. Well, thanks for hearing us out.
No, absolutely. So you guys can choose who wants to go first. We typically, since we like the licensees to talk, you can figure out who wants to go first. But tell us a little bit about what you all are endeavoring to do and how we might be able to help you.
Sure.
Yeah.
So I'll
Go
go
ahead.
ahead to start. First of all, thank you, Dr. Owens, members of the board. My name's Grant Bullock, Dr. Bullock. We're trying to expand psychiatric care into Mississippi. There's a lot of states, obviously, that are underserved, but I think that psychiatry especially is one of those things that's becoming a little bit less taboo. It's becoming more understood as a beneficial science-backed treatment. And really what we're trying to do is get an exception to the 80-20 rule and the 75-mile rule as well, so that we can do just that. In terms of psychiatric care, we're pretty much full gamut. We try to stick to more of a holistic approach, definitely trying to avoid controlled substances as able. Obviously, there's some exemptions to that, but it's certainly the last resort option for us. We like to fall back more on, kind of like I said, a holistic approach, although we're not afraid of medications, I guess I should say. Yeah, I mean, that's pretty much an overview. I guess I'll allow Samantha, I shouldn't say I'll allow, we'll have Samantha introduce herself as well, and please give us any questions that you have.
Thank you, Dr. Bullock. Yeah, so I've been a PA for a little over 8 years now. Initially did training in the ER. I actually lived in Mississippi on the Gulf Coast for about 4 years, practicing emergency medicine. And so saw firsthand, how limited access was to mental health services. A lot of patients, unfortunately, they have few options and end up in the ER or end up at inpatient facilities. So our goal is to really expand that service and hopefully eliminate, the using those resources in the ED or inpatient facilities as much as possible.
Awesome. So a couple of quick questions, and thank you very much, Samantha, for that. Dr. Bullock, what's your education and training?
So I went to undergrad at the University of Illinois, where I got a bachelor's degree in molecular biology. I went to grad school at the University of Oslo in Norway, where I got a master's degree in molecular physiology. And then I came to Las Vegas to go to medical school, and then University of Nevada, Las Vegas for residency. And then I got my board certification shortly after graduating from residency.
And so you're a practicing psychiatrist?
Yes, that's correct.
And you consider yourself general psychiatry?
I would say general psychiatry. Yeah, I try to avoid child psych, but other than that, I'd say
you knew that was coming next. So whether or not you treated children was going to be next.
Yeah, I try to avoid that. I don't have any currently. But other than that, yeah, there's no issue in psychiatry that I wouldn't treat.
So you have exclusively practiced in Nevada? Has that been the extent?
Physically, yes. There are a few other states. I see some patients in Alabama as well, but it's physically it's in Nevada.
And you've been practicing for how long?
So I graduated in 2023, so it's been about 2 years.
Okay. Got it. And so do you guys have a history of working together, or is this the first time that this is the initial collaboration that the two of you have working together, or have you had some experience working together in the past?
Yeah, it's this is our first time working together. Just to kind of get out in front of some of the other ones. Also, we use I'm sorry if I'm jumping ahead here, but we're using an EMR called Practice Fusion, so we can absolutely view each other's notes. We're following all the proper rules for documentation, for speaking to each other, for giving access to her. Obviously, if she has any questions, I'm available 24/7. Yeah, I apologize if I'm kind of stepping out of turn and just jumping ahead of you.
No, that's fine. We love information. And if you give it to us in advance, then that's like less questions that we have to ask. So that works out
Perfect.
great. So how did you two meet? How did you become acquainted?
Yeah, so I own my own practice, but it's all facilitated through Anywhere Clinic for the most part. Certainly for this, it's all through Anywhere Clinic, and so we met via that. That was how we were put together.
Okay. Well, I am going to stop talking and allow my other executive committee members to ask any questions that they may have.
Thank you so much.
Sure thing. Take it away, guys.
So, Samantha, you're located in Las Vegas as well. Is that correct?
Yep, I moved back here in June of last year.
Okay, but you used to work in Mississippi on the coast. Is that what you
I did. Yep,
Okay.
I used to work at Memorial Hospital and at Hancock, and even used to work at a couple other ERs down there.
And could you tell us a little bit about your by the way, I'm a psychiatrist up in Tupelo, Mississippi.
Nice.
I was just curious, what kind of training and certification do you have?
Yeah, so a lot of it is just, on the job training. When I became a PA down here in Las Vegas, I went to PA school in Las Vegas, and then I worked at the level 1 county trauma facility. But we had a 6-month training program where you had didactics every week, ultrasound, things like that. But you were directly on shift, and you would report to a physician or another PA. So I felt like I had really good training with that. In the ER, we do see a lot of the, more acute psychiatric patients. So that I felt, I wouldn't say comfortable with, but able to talk to patients and form a plan with my attending physician. Now, in the ERs in general, like I said, we do see a lot of mental health patients. So a lot of it is speaking with the physician, the supervisor. Currently I've only been seeing patients in psychiatry in Nevada the last month or so, but before that I did about 4 or 5 months of training where I would listen in on calls with Dr. Zan, who's our founder and lead psychiatrist, as well as with the lead APP. We have monthly group discussions about specific cases, things that maybe we need help with, or further assistance on how to treat a specific patient. Obviously the DSM-5 I've looked at up to date. There's lots of resources online, and I feel like a lot of it is learning on the job. You can read so much until you start actually seeing patients. And before I started seeing my own patients through telemedicine, I would see some of the lead APP's patients as well, present to him, as well as see patients with him there.
I was just curious what sort of psychiatric training is available to PAs.
As far as like a residency?
Right.
Yeah, so as far as being a PA, it's not, I guess, necessary to have a specific, like they call them fellowships. I know they have some in surgery and orthopedics. I'm not aware of any in psychiatry. So other than doing my own reading through, books or online training, experience with, working with the physician or the lead APP, that's about the training that I have.
And what sort of psychiatric care are you proposing to provide, Samantha?
Yeah, so most of the patients, and I'm still very new with this, right? Like I said, I've only been seeing my own patients for the last month or so. But mainly like depression, anxiety, PTSD, insomnia. There are some patients with ADHD, bipolar schizophrenia. I would hope to see all areas of psychiatry as far as patients go. Currently, I'm still very green, so the patients that I see are screened, and so I don't necessarily have anything too complex right now. But if I did, I would message or call Dr. Zand or Dr. Bullock.
Okay, thank you.
Yeah, thank you.
Hey, thank you. So my name's Ken Cleveland. I'm the executive director of the medical board here. Reviewing the protocol y'all submitted, you'll need to go back and look at the rules and regs involving supervisory relationships between a physician and a PA and revise this if the board should recommend approval of it. You currently have in there review at least 3 patient charts monthly. That's not adequate to meet our regulations, and so you would need to update that.
Absolutely. Yeah, that's we will absolutely fix that.
Sorry about that. I was having problems with my mute button. So I think, yeah, because the rule that you actually are requesting a waiver to specifically outlines the parameters for how the collaboration should go and what the stipulations are of how those reviews will be done and how many. And so that's actually listed for you, but it will need to be stated in what was provided.
Of course, yeah, I apologize for that typo. Yeah, it's the 10% or 20, whichever is less. But yeah, I apologize for the 3. I'm hoping we see more than that.
No, that's fine. But I think when we do these, we also want to make sure that everybody understands what they're requesting. And in the event that something was misunderstood, we like to use those just for clarifications. We understand that sometimes administrative issues come up, so no worries. All right, Dr. Kennard, any questions from you?
I do not have questions at this moment. I do not.
Okay, fantastic.
Thank you.
So,
I had another question.
sure, Dr. Hancock, go ahead.
I was just wondering, do you have any, I was trying to look at your protocol here, but could you tell me, do you have any specific policies on prescribing controlled substances like benzos or, other controlled substances?
Yeah, absolutely. So, like I said, we definitely try to avoid those, but if we do end up having to do something like that, we'll do a extremely thorough psychiatric medical check, something like, amphetamines, an ADHD patient, we do at least a yearly EKG. We'd require vitals. Benzodiazepines, my thought process with that is that you could basically always lower them. So under most situations, the process would be we get a patient that's already on a benzo, and then we work to lower that at a reasonable degree. It would be very uncommon to give somebody a steady chronic dose of the benzodiazepines. They're my least favorite medication personally.
Are y'all familiar with the rules and regulations concerning the prescription monitoring program in Mississippi?
Yes, absolutely. Yeah, the PDMP.
Okay, that's
Yeah,
no further questions for me. Thanks.
All right. So I think that concludes all of the questions that we have at this point. So at this time, I'm willing to entertain a motion. Everybody doesn't have to suggest a motion at once.
I'm sorry, I forgot to get my mic on. I would like to make a motion that we enter into executive session to consider this matter.
Second the motion.
So it has been moved that we close the meeting to consider whether to go into executive session on this matter. All those in favor?
Aye.
Aye.
All right. There's nobody opposed and no abstentions. So at this point, the meeting is closed. All right, so we are now back in open session, and at this time, Dr. Kennard will give the results from the executive committee.
Okay, we back on. Everybody can hear?
Did you hear me? Because I just said that you're gonna
Yeah.
give the decision of the executive committee.
Okay, thank you. The decision of the executive committee has been made, and it is to deny both requests at this time. Any further clarification can be addressed to our executive director, Kenneth Cleveland, next week.
Okay.
Thank you.
Thank you. So we can speak to him about how best to reapply and make edits.
Yes.
Okay. Thank you.
Thank you all so much for
Thank
your,
you guys for your time.
absolutely, thank you. All right, now we're going to move on to the next item on the agenda, which is that of the Zoom appearance by Robert Green, who's a PA. Oh, it's just Robert Green. And this is a request regarding 2601, Chapter 1, Rule 1.3 about required assessments. All right.
Hi, good morning. I'm not Robert Green, but I'm Robert Green's boss at Optum, so I apologize. But I'm here first, if you don't mind me kind of explaining the situation we're in, and then I can turn it over to Robert.
So typically what we do is
Sure.
we typically like to hear from the licensees first.
Okay.
And so that's typically how we like the presentations to go. And I'm sorry, you did say you were his employer, his boss, but you are, what's your name again? I'm sorry, I didn't have your appearance listed for me.
No problem. I'm so sorry. It's Gina Marshall, and I'm a physician assistant as well at Optum.
Oh, okay, fantastic. So the record will just reflect that Gina Marshall is also here and she's a PA for Optum. Okay, fantastic. So
thank you.
For a matter of our internal protocol, if we could just from Mr. Green first, and then we'll have ample opportunity to speak. Hi, Mr. Green, how are you? Oh, you're muted, I think. Or if you're not, we can't hear you. Unless you're trying to test our lip reading capabilities today.
Can you hear me now?
Absolutely. Now you sound like.
Okay. We'll just go with the headset then.
Yeah, no,
that's Is that okay?
That's
perfect. Okay. Well, thank you for giving me the opportunity to speak to the board today. I'm a physician assistant. I've been a physician assistant now for 20 years. I graduated in Oklahoma at the Oklahoma University of Health Science Center College of Medicine, 2005. I've been working as a physician full-time now for 20 years without any gaps. I was in neurosurgery for 14 years. And then I joined United Health and Optum for the last 6 years in the utilization management division. I'm on a team of physicians and physician assistants who's tasked with adjudicating claims for medical necessity on the post-service side. And I'm also part of a smaller team within that adjudicates claims within Mississippi. Mississippi has now has a requirement for a state license for those who adjudicate. It's not that uncommon. We've run into this with lots of states, and which hence why I applied for the license. I got denied, and I feel like there might have been some sort of miscommunication on my part or a mistake, as this has not seemed to have been an issue in the past historically, at least even with Mississippi, from my understanding. So I believe I was denied for not practicing. I have maintained my license, my National Board Certification or NCCPA certification, and CME all these years. We're required to. We're not even allowed to work in this team without doing that. So I don't think that was the issue, but that's why I'm here.
Thank you for that. Sorry, Ken.
Well, I was just going to explain a little bit. So he has not actively practiced in medicine seeing patients, and I believe it was since 2019. So he has not actively clinically practiced since 2019. So there's, if this was a MD or DO, we would advise them to seek an administrative license, but no such license exists in our system for PAs. For him to qualify for a license without an exception from the board, he would need to do, he would have to prove clinical competency and or do a reentry program. And so that's the issues that are before the executive committee today.
So, Ms. Marshall, we will go ahead and allow you to speak now.
Thank you. And I apologize. I spoke first. I wasn't sure of the rules, so I apologize.
No worries. That's okay. We're fine.
So I just came on board because we are in a unique position. There's 19 PAs on my team, and there's about 30 PAs on the appeals team. So in the United States, there's only 50 of us that do this. And like Bobby said, there are state rules that came out January 1st, 2025, where you must have a same state license to review those claims. The physician assistant department under my leadership at Optum reviews claims for Medicaid and the DSNP line of business. And the reason we do that is because, number one, our salaries are less, we're cheaper, and the reimbursement for Medicaid is lower. So we do have the state of Mississippi. I only have one PA right now with a Mississippi license. So I'm trying to divide my team up to get certain state license so we can adjudicate those claims in the member's best interest. And you're not waiting 6 months or a year to hear back on that information, because that's never good for the patient. So we do members, post-service claims, providers, as well as hospital systems. And I really wanted people, so I have Bobby and then one other PA that has Mississippi license, to do the Mississippi claims so they understand the state grid. They understand all the laws in Mississippi. I really don't want people reviewing all over the United States because it's hard. It's a lot of rules. It's a lot to keep up with. So I was hoping that Bobby could get a Mississippi license. We see a lot of surgical claims in the Mississippi area, and he has a very large neurosurgical background. So I feel like he's one of my best candidates to get this Mississippi license. And I'll tell you that when we review the claims, physician assistants can allow the claim and allow the company to pay it. And despite what probably media or anybody else says, we really do want to do the best thing for the member and allow those claims. If claims are denied, they must then go to our Mississippi licensed physician for denial. So PA will never deny payment to a facility, a member, or a hospital system. And can I say one more thing? I'm sorry.
Absolutely.
I'm trying to wait for the pause. I don't want to talk over you. The other thing I was going to say is, to be in the role that we're in, you must have 10 years of clinical experience. Like Bobby, most of us have 20 plus, because to review medical claims in every area of medicine, inpatient, outpatient, radiology, you have to have a very large depth of knowledge for medicine. We do continuing education and training all the time. And I will tell you, my background is in orthopedics and plastics, and I know more medicine today than I did when I was in clinical practice. So I feel confident that Bobby has very up-to-date medical and surgical knowledge, and we keep up with all the new procedures, the policies, as well as new equipment, et cetera. And that's why I'm really hoping to get Bobby so he can dive into the Mississippi rules and provide those members and claims an efficient and accurate review.
Thank you for kind of filling in about kind of at least the demonstrated need that has prompted, this request for waiver. We appreciate that.
Of course.
At this time, are there any specific questions? And Mr. Green, would you prefer that you go by Bobby? I was calling you Robert. I was calling you by the
That's okay. I do go by Bobby typically, but either one's fine.
Okay, I got it. Any questions from the executive committee?
I have one, Michelle.
Okay, go ahead.
Thank you very much. Bobby, I'm out of pure curiosity, does the PA program in Mississippi or nationally have its own reentry program for situations where you've been out of clinical practice and wanted to reenter. I understand the nuances of this that are different. It's not one-on-one actual medical care. It's more of a review and report. But do they? Do you?
I am not familiar with Mississippi. My license, my training was in Oklahoma. We do not have a reentry type program for this type of work. We just, with our board, we're just registered as administrative PAs and not required to have a supervising physician during that time here in Oklahoma. But for Mississippi, I don't know the answer to that.
Okay. So it likely just falls back to the state regulatory board for the PA, which in that case would be us. Thank you.
So Mr. Green, I got a question for you. It's a little bit easier question than the question that you just got asked. Sooners or Pistol Pete? That's what I want to know.
Oh, well, you know, I graduated from OU, so I'm going to have to say Sooners, unfortunately. But
you know, I just had to ask. Just had to ask.
Sure.
Okay, so yeah, we Dr. Lippincott, do you have any questions at all for either of our two the two people before us right now?
Yeah, I'd just like to ask Ms. Marshall that how many Mississippi licensed physicians do you have? And does Bobby have a designated supervising physician? Would he have a designated supervising physician in Mississippi?
Yes, sir. Great question. So we have 6 physicians out of a team of 78 physicians who have Mississippi license. We would put him with a individual licensee if he gets his license, and the 6 physicians would sign off on 50% or more of his cases on top of every denial. So there's very high quality, and to ensure that physician from Mississippi is reading through all of his notes and can always overturn a decision that he makes.
Thank you.
And I just want to say, and I'm sure y'all know this, but just to lay out there that we're never going to diagnose, treat, or prescribe medications in this role.
And Bobby, you mentioned that in Oklahoma you have an administrative license. Is that correct?
No, well, it's not a different license, but if you are no longer actively doing clinic, and when I took this role, for instance, I have to register who my supervising physician is. And so when I had to make the change, I did ask them, you know, this is a unique role, you know, that we're doing. We're not directly treating patients. And for Oklahoma, I just have to let them know that. And so they therefore put me as a non-clinical PA with an active license, and I still have the same requirements. And then if I go back to the clinical space in Oklahoma here, of course, that would be under a supervising physician, and that would be renoted on the board. So,
okay, thank you. Thank you.
Thanks, so, and that actually just brought up a question that I did have. I didn't think I had one, but here's another. So for the requirements, and I don't know if this is one for you, Ms. Marshall, or if it's something that you can answer, Mr. Green, but is the requirement or your employment requirement such that does it require a unrestricted license?
Yes,
or
we all have unrestricted license.
So they're considered unrestricted licenses.
Correct.
Because I was trying to be creative, and that before I started letting my creative juices flow, I wanted to make sure that I knew the answer.
Dr. Owens, if I may. I think
we lost Gina. I think she inadvertently clicked herself off the link.
Fell off, huh?
She'll come back. There she is.
I don't think she's going to miss anything by what I have to say, because it really applies to Mr. Green. I think if it would make the board feel comfortable if he spelled it out in his collaboration agreement that he would not be practicing clinically, that he would limit his practice to these reviews, and that if he ever did want to practice clinically in Mississippi, he would have to come back and change his collaboration agreement. I think that could give you some level of comfort. that with giving him an unrestricted license under that type of collaboration agreement.
Well, I appreciate that, because, and I guess maybe we've been working together long enough, because I think you were reading my mind, because I was trying to figure out, that's why I specifically asked about a restriction, because
Yeah.
sometimes if we make those stipulations, then it's considered a restriction. Like if we said limited only to administrative review and not to include clinical care, I just didn't want it to be considered a restriction where you've come and asked us for something and we're trying to help, and by trying to help, we end up doing something that
Right. And you know
Yeah.
what, with you saying that, can I add one thing? Because I may have answered your question incorrectly. To be hired for this position, you have to have NCCPA board certification as well as a primary unrestricted license. Bobby has a primary unrestricted Oklahoma license. So if y'all wanted to grant him a Mississippi restricted, I would be fine with that. I just needed him to review claims. And I've already written out for other states, Maryland, Hawaii, that we do not diagnose, treat, or prescribe medications in this role. And we would absolutely put that in our supervising agreement.
I think it's in Mr. Green's best interest for us not to give him a restricted license. That would be
Okay.
actually reportable if we were to do that. I think if we handle it through the collaboration agreement, as I mentioned earlier, and maybe we lost you for your connection for a minute. What I had recommended is that Mr. Green present a collaboration agreement or supervision agreement that allows him only to do these reviews and not to participate in clinical practice. But his license type would still be considered unrestricted.
That would be great.
Okay. All right. So any other questions? Dr. Cleveland, thank you so much for that. Any other questions from the executive committee? Hearing none. Is there a motion?
I would like to make a motion that we make an exception for the requirements of Part 2601, Chapter 1, Rule 1.3, with the stipulation that his collaboration agreement stipulate that he will be doing administrative duties only. Please.
I second that. And is that just an administrative thing where he goes back and performs that, and as long as it's satisfactory to you, you'll grant him the license? Okay. Yeah.
That was one of the nicest motions I've ever heard. You after Ken, see that? All right. So it has been moved and properly seconded that the request for licensure be granted, or that the application be granted based on the stipulation of approval of the limitation of the practice to the utilization, whether it's utilization review or utilization management component, and not to include direct clinical care, as that's the basis of the request. Is that okay?
Yes.
All right. So all those in favor, please signify by saying aye.
Aye.
Sorry. Aye.
I got you. I heard it. All right. So then under those conditions, this request is approved.
Thank you so much for your time.
Thank you. Thanks so much for being here. We appreciate you.
Of course. Have a great day. Thank you.
All right. So we are going to now move on to the next item on the agenda, which is a personal appearance by Dr. It looks like Eswara Kumar Mundra. If I did not pronounce that correctly, my apologies. Accompanied by Attorney Doug Mercier. Is Dr. Mundra with us? Oh, in person. Great.
Yes, ma'am. He's coming in now.
Fantastic.
Dr. Mundra, if you want to come to the podium, that'll be fine. They're going to want to hear from you first.
Good afternoon to everyone. Thank you for allowing me, and thank you for giving the opportunity to express my, opinion. My name is Dr. Mundra. I am currently practicing as a radiation oncologist at University of Mississippi Medical Center as an assistant professor and a program director for the residency program. I came to the Mississippi in 2015 and joined in the department as a fellow. When I joined as a fellow, I had already MD degree from my home country in the radiation oncology. So here in the US, if I want to be a radiation oncologist, there are two pathways, either through the ACGME program or alternative pathway. Because of my MD degree from India, the American Board of Radiology allowed me to pursue this alternative pathway. At the same time, I need to do this alternative pathway in the residency program. So according to their recommendations, I completed the 4 years of alternative pathway, and I completed all the 4 exams to get the board certification, like physics, biology, written boards, and oral boards. So I board certified in 2022. Since then, I'm maintaining my certificate. The other thing is regarding the USMLE, I didn't meet the 7-year rule because, during the COVID time, I lost my father and grandfather. So because of that, it took time, but finally I cleared that exam with passing of 210 marks. Because of the Mississippi State Medical Board license, because to get a permanent registration, the 7-year rule, I didn't meet that one. But at the same time, I was awarded the Best Teacher Award by the students 2 times. At the same time, I published almost 17 art publications in the radiation oncology as a co-author in the major conferences. And I'm still, in a good conduct and no allegations, and I'm helping the residents. At the same time, I'm giving the good treatment to the people of Mississippians. And at the same time, I want to, continue to hear and serve the people of Mississippi. Right now, I am on limited license since 2015. So because of not meeting my 7-year rule, maybe, at the same time, because I have, board certification and I have, publications and, working in the university as a assistant professor since 2019. I started as a fellow in 2015 and finished in 2019. At the time, the department offered me a job as an instructor. So in 2022, when I cleared my board exams, they gave the assistant professor. 2 years ago, they offered the program director position because of my, goal, my achievements. So still, I am continuing as a program director. So.
Thank you.
I'm sorry, Michelle, if I could just point out, there's actually 2 issues here. The 7-year rule is actually, in my opinion, not a big deal. We give exceptions to that one almost all the time. The exception that Dr. Mundra really needs is the postgraduate training in the United States. He has not received the number of years that are required by our rules of ACCGME, of ACCME approved training in the United States.
So,
hold on a second. So Dr. Mundra, you mentioned, and this was actually going to be my first question, so we might as well hop on it. So you did so after completing your training abroad, you came here in 2015 as a fellow, correct?
Right, ma'am.
And how long was your fellowship?
It was 4 years, ma'am.
So you did a 4-year fellowship in radiation oncology?
That's true, ma'am.
Okay. Do you know Dr. VJ?
Yes, ma'am.
All right.
Mm.
So you did 4 years of postgraduate training at the University of Mississippi Medical Center in radiation oncology. So from 2015 to 2019.
Yes, ma'am. That's true.
All right. Because we have quite a bit of information that was submitted with respect to your license, and I was just trying to make sure that I had a good grasp of how much training you actually have done. And now, other question, that radiation oncology fellowship is an ACGME approved fellowship, or is it not?
According to the ABR requirement, this alternative pathway must be done in the radiation oncology residency program. So because our residency program is accredited residency program here in the University of Mississippi.
Right, but it's the fellowship. So you did a fellowship, you didn't do a residency, correct?
Yes, that's true, ma'am. That's true.
So my question is a different question. My question is the fellowship that's offered in radiation oncology at the University of Mississippi Medical Center a CGME approved fellowship, or is it just a fellowship that is offered in radiation oncology?
It is just fellowship offered in the radiation oncology, ma'am. It's not.
Got it. Okay, because that helps to clarify. That was one of the clarifying questions that I had in reviewing your materials. Now you seem to have wanted to speak a little bit more, so I'm going to turn the floor back over to you and let you say whatever it is that you wanted to share with us.
Okay. So when I joined in 2015, because of my MD degree, our department chairman wrote a letter to the ABR board with the agreement of doing this fellowship in the radiation oncology program, which has a residency and it has accreditation. Because of that rule, the ABR gave the permission to do this pathway.
So this is it was an alternate pathway that was made available to you.
Yes, ma'am.
And there was an exception that was granted that allowed you to be able to do this pathway.
That's true, ma'am.
This is not a traditional way that people would normally matriculate through the process.
That's true, ma'am. Because I have that MD degree from abroad, so that's the reason. Because
Okay. Any questions from the members of the executive committee? Dr. Mundra, with respect to, and I think Dr. Cleveland has kind of addressed the issues of your USMLE. The USMLE issue, was it just about time, or did you have to take it over?
On time, ma'am.
So were you successful in each of your attempts?
Yes, ma'am. Yes, ma'am.
Okay. Any questions from any other board members? You have been certified since 2022. You've had ABMS certification since 2022.
Yes, ma'am. That's true, ma'am.
Does your board offer, is there like an alternative pathway to certification through the board for radiation oncologists?
Yes, ma'am. Radiation oncologist and also radiology. Those are the two specialties, like, people who have MD degree from their home countries. This is the other route to get the board certification, ma'am. But at the same time, they need to work in the residency program for 4 years of period, because, the teaching the residents what they are getting the same thing we also get. And at the same time, we see the patient, make the notes and make the plans and discuss with the attending and presenting in the conferences,
And you said you're program director right now?
Yes, ma'am.
And how long have you been in that role?
2 years, ma'am.
And your faculty appointment at the University of Mississippi Medical Center, what is your actual faculty title?
Assistant professor, ma'am.
Assistant, okay. All right. Any questions from any of the other members of the committee?
So I'm Ken Lippincott. So you've been board certified since 22,
Yes, ma'am.
and
Sorry.
and have you had a Mississippi license before?
Because at the time, my department chairman wrote a letter because I finished all the physics, biology, and the written boards. So they allow me to write, because at the time I have a limited license, they allow me to write these oral board exams.
So you've had a limited license?
Yes, sir. I'm right now, I'm limited license.
And you're applying for an unrestricted
yes, sir,
license?
Yes, sir. That's
I understand. Okay, thank you.
So you have a limited license. Is that limited license just to cover, it only covers you working at the University of Mississippi Medical Center? Is that the limitation that
yes,
currently?
yes, ma'am. That's true, ma'am.
Do you hold any licenses in any other states?
No, ma'am. This is the first state. When I came 2015, I was here only. I didn't go anywhere. And
So if there are no further questions from the rest of the executive committee, well, let me see. Mr. Mercier, did you have a statement or was there anything that you wanted to say?
Thank you, Dr. Owens. Thank you, Dr. Owens. I believe Dr. Mundra covered just about everything. There's just one thing I would like to add just for the record. What he is seeking technically is a waiver under Part 2601, Chapter 2, Rule 1.2 of the Administrative Code.
Yeah, I believe that that's how he's listed on the agenda. I mean, I was actually kind of not at that point, but I think that that's it. Are you suggesting that there needs to be a correction to what we currently have listed, or are you in agreement with how it's listed?
I haven't seen it. I just, whenever I see
Okay.
the letter in, I just want to make that clear in case y'all go back and deliberate which one it is to look at.
Yeah, no, we have that, but thank you.
I may be mistaken. I thought it was 2601.
I think it's
have-
listed for us differently. That's why I was trying to make sure I knew because what we have is 26, I thought we had 2605, Part D. That's 2605, Chapter 1, Rule 1.1, Part D, and it's subsection 2 there, and Rule 1.3, Part B. That's what we have.
That's correct.
Yeah, that is correct.
I stand correct.
All right. So hearing nothing further, Dr. Mundra, was there anything else that you wanted to say to us? Are you comfortable that you've said everything that you had on your heart today?
yes, ma'am. Yes, ma'am. That's true.
Fantastic. Well, we thank you so much for your time and for the wonderful work that you've been doing. And at this time, I am willing to entertain a motion.
I'll make a motion that we approve Dr. Mundra's application with an exception to Part 2605, Chapter 1, Rule 1.1D of the Administrative Code. And also an exception to the rule that the 7-year rule. Thank you.
So there's a motion for approval. Is there a second?
No second, but a motion to close.
Okay. If there is no second, then is there, so there's no second, so that motion doesn't go through. At this point, is there another motion?
Yes,
And what would that motion
Yeah.
be?
that's to close the general board meeting to consider going into executive session for further discussion.
Second.
So it's been moved and properly seconded that we close the meeting to consider whether to go into executive session on this matter regarding the request for unrestricted license by Dr. Mundra. All those in favor?
Aye.
All right, so then the meeting is closed.
They're gonna get
All right, we are back in open session. Can everybody hear me? Just make sure, raise your hand or something.
Yeah.
Okay, perfect. We're back in open session, and the view that I have is actually not looking at the audience. So, is Dr. Mundra and Mr. Mercier, are they?
Yes, they're present.
Perfect, thank you. All right, so at this point, Dr. Kennard will share the decision of the executive committee from executive session deliberations.
Yeah, thank you. The executive committee decision is to deny the request. And any further discussion or clarification about that matter can be addressed to our executive director, Dr. Cleveland, next week, though, please. Thank you.
Dr. Mundra, thank you so much for your time. And you and also Mr. Mercier, thank you for being with us. And you can reach out to Dr. Cleveland next week for further information and discussion.
And this does not affect your limited institutional license. You can continue to practice at university under it. Okay?
All right. So at this time, we will move on to the last item on our agenda, which is the executive director report.
Thank you very much. So I'm going to try to keep this brief. I have actually expanded my report to the full board tomorrow. And so just as a quick summary, though, I continue to meet monthly with the other health boards, Board of Nursing, Board of Pharmacy, Board of Dentistry, and the Department of Health. Continue to meet monthly with our Physicians Health Program. Met with about 4 different licensees over potential violations of the Medical Practice Act to try to help them see the errors of their ways and to improve them without action having to be taken. I presented as a panelist at the tri-regulatory meeting of the boards of pharmacy, nursing, and medicine. I also presented at the North Carolina Board of Pharmacy Compounding Summit as a panelist. I presented at the most recent NADI meeting as a panelist, and then there was a lot of us, but we attended the most recent FSMB annual meeting in Seattle and learned a lot. And not only that, but had a good time while we were there. So with that is my executive committee report, executive director version of the report. And then, like I said, I'll have a more expanded version for the full board tomorrow.
Thanks, Dr. Cleveland. Any questions from the executive committee regarding Dr. Cleveland's report? All right. Thanks. Well, any other issues or items? We've reached the end of our agenda. Any other unfinished business, new business, or other special announcements from the group? Hearing none, we can entertain a motion to adjourn.
So moved.
Second.
All right. There any discussion on this? All in favor?
Aye.
Perfect. Thank you all so much for your time and for your service, and I look forward to seeing you all in person on tomorrow.